Okay, so now we're going to start our 10-20 head setup to do our sleep patient. First, these are the wires. And for preparation, you need gloves, thermistor and PTAF. You need gauze, Q-tips, tongue depressor, 10-20 paste, electrode connectors, new prep, alcohol, a sonometer measuring tape, a marking pencil, ties, a head box, and belts. Okay, so our last step here is that we have to put a thermistor and a PTAF on the patient. This is our PTAF. This picks up pressures that are coming in and out of the patient's nose and the patient's mouth. Our thermistor that actually picks up the temperature change between air going in and out of the patient's mouth actually fits and slides down into there. And then we take this whole apparatus and we have the patient guided into their nose. And then we just slightly tighten it into the back. And then you just want to make sure that it is centered in the patient. This should be going and looking just about like that. Okay? So, once we have that, our next step is that we have a head box. With our head box, we need to connect all these wires that we just previously pushed on the patient. And we'll just film the head box here, and you'll see me plugging in the wires. These were our left legs. Our right legs. This is our EKG1 that went under the left arm. This is our EKG2 that went on the right chest wall. These are our referencing grounds. This is the two stickers that we put on the forehead. One goes in reference, one goes in ground. This is the patient's eyelid on his face. This was his left eye and his right eye. And you see it's kind of like a little person. Here's the nose, here's the ears. Here's the mastoid plugs that we plugged behind the patient's ears. Mastoid 1, which would be the left side of the head. Mastoid 2, which would be the right side of the head. This is for our chin leads that we did from left to right. So this is for chin 1, chin 2, and chin 3. Okay. And the remainder of the plugs are the gold cups that we put to the patient's head. So this is CZ. This was the center of the head that we'd done. This is C3. This is where we came down 20% to the left side of the head. This is C4, the right side of the head, where we also came down 20%. This is the back of his head, which also records his eyes. So this is his left eye, his right eye, and then traveling back to the front of the head. This is the right side of the front and the left side of the front. So that's pretty much all. That's all the head leads that we need to plug in. The only thing left that we need to attach is for our PTAF and for our thermistor. Our PTAF records the airflow, the pressure of the airflow, but also does pick up our snore for us. So we'll plug those right into here. And this is the thermistor, the one that detects the heat. So what I'm going to do is, the PTAF connects just like this. And the thermistor wire connects just like this. But once the thermistor wire is connected here and plugged into the box, it also has a second check to make sure that it is working correctly. You want to check the patient's circuit, and it will turn green so you know that it is a good connection. And that's it as far as the head box. The patient's completely wired and completely set up, and at this time, all you're going to do is bundle the wires. Makes it so you don't have any kind of slack. You're going to ask the patient to put the chin to chest for me, please. And you're going to make sure that you give them enough slack, that it's loose enough there. And then you're just going to continue on, and you're going to keep putting the ties on. Okay, now the patient is plugged in and the study is running. The first thing that we're going to do now is do device calibrations. And that calibrates the equipment. It'll run across a 30-second screen here. And now that's completed and we start to see our waveform coming back. So now we're going to do our impedance check. We've now done our impedance check to make sure that all our wires are functioning correctly. And now we're going to start with our patient biocalibrations. The first calibration that we're going to do here with the patient is we're having the patient make sure that he maintains and keeps his eyes open. Okay, going to start with your calibrations. We need you to lie on your back and have your eyes open, please. And mainly the light purple at the top of the screen is the patient's eyes. Okay, now we're going to have you close your eyes and keep them closed. Again, the light purple at the top of the screen is the patient's eyes. I'm going to have you open up your eyes. This is eye movement only, so do not move your head, but with your eyes, I need you to keep repeating the pattern of looking up and down, up and down. Again, this is eye movement, the light purple. Now coming into the screen, you'll start to see the patient's eye movement up and down. Great, and let's change that eye movement to left to right, left and right. And now coming into the right of the screen, you can see the patient's eyes moving left to right. Okay, I'm going to ask you to blink your eyes 10 times. You can see the waveform change again. Patient blinking their eyes 10 times. Now have you noticed the hot pink? That is the patient's chin leads. I'm going to ask the patient to bite down hard so we will see all the head leads and the chin leads show that amplitude. Let me have you bite down and grit your teeth for me, please. And that should be coming up right through the screen. And here it comes into the view. Okay, relax. Take 3 deep breaths in and out through your nose only. Now you'll see that come into the bottom of your screen. You're seeing the patient's flow at the bottom of the screen. You'll see the amplitude go up. And now I need you to breathe normally in and out through your mouth only. And again, at the bottom of your screen, you're going to see the belts and the patient's flow, showing breathing in and out. When you're ready, I need you to take a deep breath in and hold it for about 10 seconds or as long as you can. And again, if you keep it to the bottom of the screen, you'll notice that the flow ceases and all belts remain flat. That's showing that the patient is not breathing. It's coming into the screen bottom right now. Excellent. Go ahead and start breathing, and you'll see the waveforms start to come back. Now, if you look to the orange on the screen, those are both the patient's right and left legs. I'm going to ask him to please flex just your left foot for me. And you'll see that come into screen. And there it is. There's the amplitude of his left leg. Okay, let's stop and switch to the right leg, please. And now you see his right leg coming into play. Okay, go ahead and relax. If you notice the green underneath the orange, that is the patient's snore monitor. Please give a fake snoring sound if you can. And you're going to see that come into play. Great, thank you. Last thing here, this is paradoxical breathing. I need you to take in a deep breath, hold your breath, and push your stomach muscles in and out over and over again like you're attempting to breathe. And if you'll note, the flow goes flat right here, and you'll see the belts still moving for the patient trying to breathe. Great, go ahead and breathe. Okay, and that's what does patient calibrations. So now we just start the patient study, and they're all set.